So, good morning everyone and welcome to our latest ARCFEST of the NHR Applied Research Collaboration Northwest Coast. My name is Professor Mark Gabbay and I'm the Director of the ARC Northwest Coast. Regular attendees to these ARCFESTs will already know that, but we always have new public advisors, representatives from our members and other stakeholders joining us at different ARCFESTs as we hold them every 3 months to feed into our portfolio of work. So a big welcome to everybody. It's important that I start with some housekeeping rules for us all to ensure that things run smoothly as we proceed throughout the day. So here are some housekeeping rules for you. The meeting will be recorded and attendees and speakers may appear during sessions. However, if you still feel uncomfortable about that, you can turn your video off, although we would actively encourage you all to keep your camera on to help ensure that the sessions feel inclusive, especially during the theme discussions so that you can see each other. However, can I ask everyone to stay on mute to avoid any disruption, unless speaking, of course. And we do love listening to other people's telephone calls during a meeting, but sometimes it can be a tad disruptive. Can I also encourage you to make use of the chat function for questions and answers during these sessions, both we're all together and for the individual theme sessions later. If your comment isn't answered for some reason today, we will take details about the question and the person who asked it, and one of the team will get back to you as soon as we can find the answer for you. As people are talking throughout the day, sometimes ARC staff will be adding links to the websites or documents to complement what is being discussed. So rather than go to them there and then and come out of the system, I suggest you copy and post them to look at them afterwards. And if you miss any of them, please use the email address to contact us. The presenters in these sessions are using Zoom and it will be used for the breakout rooms as well. But this will be managed behind the scenes and embedded within the platform we're in now. So you shouldn't have to move away into Zoom or worry about leaving the site to go into Zoom. If you get lost at all, click on Sessions on the left-hand menu of your page in front of you on the screen, and the activities today will be listed there. Your choice of theme meeting will also be there, so this should be able to give you access to the meetings for the themes that you've chosen to attend today. Now, unfortunately, there have been a few cases of online Zoom meetings being hijacked by hackers, but we don't anticipate that. And I'd be surprised if we were targeted. However, if this was to happen, we would immediately shut down the meeting, and we apologize for that in advance. But as I say, that's highly unlikely. I don't think we're that famous internationally yet, but you never know. If you need any technical support at all during the event, one of my colleagues will post an email into the chat now with a phone number, and please keep this handy for the day in case you have any problems. A couple of other important updates I wanted to provide you with just before we start. We provided our funders, our central funders, the National Institute of Health Research, a comprehensive update report last month, summarising our progress on our research activity, public and member engagement, finances, and any adjustments we made to our original bid for funding. This was to demonstrate and how the foundations have been laid for another 3 years of the ARC through to autumn 2024. This report will be taken to a panel in the next month, and following those deliberations, like other ARCs, we should hear the outcome in June or July. However, we're confident we've not only provided a strong case for funding for the next 3 years, but have also received an audit report. We complete an annual report every April for the NHR for our first year, and we got a solid green light for that, which complimented us on areas of our work, some of which they want to roll out nationally, and some minor appointments for suggested improvements, which I'm pleased to say we've responded to successfully. The ARC is complex, and it's easy to forget the importance of keeping a bird's eye view on all of our work, just to understand the breadth and depth of the research within the collaboration which we're delivering across the region, and the implementation of that research as well. If you get a chance and haven't done so already, do look at the rotating graphics on the home page summarising our achievements, on our what we call our TV channel. Sometimes we forget what all of us as a collaboration have achieved to date, and it's important to remind ourselves of that. In addition, there are lots of studies and pieces of work going on in individual themes, and I hope today enables you to get some feedback about what that is and for you to feed in your thoughts and views about what we're doing. To contribute and participate in these initiatives enables you to tap in and then harness your own skills for the benefit of us all, and also your passions and energies for the work that we're doing. So just a few updates of what we've been up to since our last ARCFEST. We've been progressing our project with colleagues at the University of Lancashire and Preston City Council to evaluate the Preston Community Health and Wealth Building Initiative, and have just received a large external grant to help us do that. Our publications have nearly reached 100 since we started the ARC Northwest Coast 18 months ago. That's quite an achievement because it took us nearly 4.5, 5 years in the Clerk to get to 100 publications. And it's a real credit to the work that we're doing that we're now being published so widely on the work that we're doing. And I want to thank everybody who's played your part in helping us reach this excellent milestone. Indeed, one of the things that helps set this ARC apart from traditional research is that many of those papers include our colleagues, both professional colleagues and public advisors, as co-authors in those publications on our work. These publication numbers is a metric which we're judged on. It's not just about numbers, but it also demonstrates the collaborations that we've been taking with our co-authors and the scope that we've been covering with our work. And of course, as you know, we have the impact team, which you'll be hearing about later, and they help us take those findings into implementation through to our member organizations. Hopefully, you will also have seen there's an uptake of our use of data modeling tool that we developed from Clark. That's being used quite widely by local authorities, not just in our ARC, but more widely across the country, and has helped with planning around the COVID pandemic and identifying populations that are particularly vulnerable to infection and helping local authorities plan interventions to help protect these populations from major outbreaks. We've been involved in many national ARC projects, but the non-COVID ones have obviously been slowed up by the pandemic. We've recruited over 20 PhD students, and a selection will be showing their work today to you, and it's great to have them in the ARC team with us. We launched our health equity mainstreaming strategy this year. That's a fancy way of saying that we have clear instructions and guidance for ourselves and for the people who work with us on how to make sure that all the work we do thinks about inequalities and thinks about equity, not just the research, but meetings and everything that we're doing. So we think about that when we're setting up meetings like this, how we can ensure equity of access as much as possible across all the people that would want to engage with us. So please have a look at that on the website. And it's there for you to see the summary along with many of the other things that we've been developing. We've also held the first of our inaugural, well, if it is our inaugural, it will be the first, wouldn't it? The inaugural Seldom Heard Voices Forum. And thanks to everybody involved, there were over 60 people came to that, and it's a chance for us to hear the views and experiences of people who wouldn't normally get engaged with this type of work. And I think it's a great credit to us that we've managed to set that up and get so much traction so early into it. Our new public advisor co-leads have now joined all of the ARC Northwest Coast themes. You'll meet most of them today in your meetings, and they will further embed and lead co-production and public involvement in our work. This is all of our themes will have academics and the public and professional colleagues as co-leads when you come to meetings such as the ARCFEST, and working behind the scenes to ensure that we engage widely across all of our stakeholders. On the back of this, we've also produced and published on our website our new public and community involvement, engagement and participation strategy, and we'll pop a link in the chat to that on our website as well. Dr. Giebel pulled together and chaired our Household Health Survey dissemination event, which showed the results of over 5 years of research into health inequalities across the communities that we face across the North West Coast region. The full event is available for you to watch on our YouTube channel on our website. If you want to be social with us, our Twitter hashtag is @ARC_Northwest Coast, which is in the chat. And you can also use the hashtag #ARCFEST21, all in capitals, which we'll use for all ARCFests throughout the year. So just to recap, so we can get back onto the main business of the day. For the next couple of sessions, you don't need to press on any buttons and can stay where you are now. Please use the email and post it in the chat if you have any, which has been posted on the chat now, if you have any issues moving between sessions. We've got a mix of live and recorded items. You may not be surprised to guess that this is a live item just now. If there are any gaps in events for the day, or if you come across any bumps in the virtual road, I will jump in with some words of wisdom, a bit like the potter's wheel while it gets sorted out in the background. So without further ramblings or stumblings from me, we're going to start with introduction from Dr. Shaima Hassan, who is one of our postdoctoral researchers, associates, and she's going to talk to us about how we have set up a system for you to submit ideas to us, and what happens when you do first come to us with an idea, and what we do with it within the collaboration. After that, we'll go straight into a public involvement update, and from that, from our lead, Selina Wallace, and a selection of our public advisors. So, thank you for listening, and without any more ramblings from me, over to you, Shaima. Good morning.